Good afternoon, everyone. Today is our briefing for August the 17th, 2020. And of course, as always, we'll have an update in Spanish at the end of the briefing. And we have, of course, ASL translation as always with Paola, so thank you. And Dr. Davis from the Long Beach Health Department will be giving an update after me, as well as answering any questions that the press might have. I do want to start, though, with an important message about what's happening right now with power outages and some of the state messaging and really asking of us as a community. So we know the state is currently monitoring and participating in planned outages. The key thing right now is trying to conserve energy all across the state of California. In our case, the state is working with Southern California Edison, who is our provider here in Long Beach. And as most of you know, we had a planned outage just a few days ago here in the city. We have record-breaking heat happening in California, as well as a strain on our energy systems. And so we need to be prepared for these rolling outages that are occurring. We have, as we know, some hot days. We certainly had some. We have some ahead. And as far as outages are concerned, I just want folks to know that we don't control the power systems per se in our city. So that's an Edison function, but of course they are a partner, and we want to make sure we communicate how we conserve energy with each other. During this warm weather, it's important for us to shift our energy use, if at all possible, to early in the morning and late at night, conserving energy during the day. Between 3 p.m. and 10 p.m. are the critical times when the state is currently seeing a huge amount of use and energy use. So please, if you can, avoid laundry and the dishwasher and keeping lights on during the day. Please turn off unnecessary appliances. And of course, we know that it is hot. Folks want to turn on their air conditionings. We understand that. But we ask that if you are part of your utilities power sharing agreement, or if there is a demand response program that you want to consider, please consider those. There are voluntary energy conservation programs, which we think are very helpful as well. We want to make sure that people know, especially seniors and folks that are vulnerable, that we have opened up cooling centers across the city of Long Beach. Those are available at Admiral Kidd Park in West Long Beach, at El Dorado Park West in the eastern portion of our city, at Houghton Park in North Long Beach, at the Long Beach Senior Center, of course, here in closer to our coast and closer to Alamitos Beach, and in McBride Park in the central part of the community. All of our centers are operating in compliance with our COVID health orders, but it is hot, and we want to make sure that seniors and others have access to a cooling center if necessary. Want to now, of course, transition to our update around COVID-19. Today, as of today, we've had 9,736 residents who have tested positive. I want to share our positivity rate. Our positivity rate is at 9%. Last time we gave the positivity rate, I believe it was 8.7%. However, the rate is essentially flattened and around the same, and I want to explain that. We noted that a lot of positivity rate information was still coming in from the state as far as updating our numbers. So we were getting some other additional tests in. And in talking to our health department director earlier today, it appears our positivity rate has stabilized around 9%. That approximately, for us, we know that we need to get that 9% much lower. 8% is the initial state goal, which we're trying to get to. And as a reminder, we were around 15% about a month ago. So we want to keep that progress going. We want to get that 9% really lower and get even lower than 8%, which we're headed towards. So let's work towards that. We also want to share that we have lost 190 residents to COVID-19, each one someone that folks loved, and of course, is an individual beyond just the data that we're sharing. I want to remind folks that all the data that we share is also available on our dashboard at all times. And that's at the longbeach.gov/COVID-19 website, and our dashboard is available there. Let me share a few comparisons with how the state is doing. It's really important for folks that are asking a lot of questions about what's the future of small businesses, what's reopening schedules look like, how are schools doing. We have, as you know, shifted in the last month or so from much more of a statewide approach across the state of California. And the governor has been leading an effort to ensure that we're keeping folks safe. And I want to thank the governor and his team for their work with us here in Long Beach. As we know, across the state, there have been 621,562 cases of COVID-19 reported in California. We've had about 11,200 fatalities statewide. There are currently in California hospitals about 5,027 people that are hospitalized. That's the big picture, and we have a couple slides, some you've seen before, to compare some of our data with the state. The first slide you see up here is one we've shared before. It's a number of COVID-19 cases per 100,000. Long Beach is represented in the light blue line with a case rate of 2,083 per 100,000, which we know has been higher than the state. They're at 1,573 per 100,000. And the yellow line, of course, is LA County. And so we've always compared those lines as well as with the city of Los Angeles. So we have continuously been a bit better than the county in LA from a cases perspective, but still lagging the state, and something we're always looking at as we move forward. This other slide, which you've seen, of course, is deaths per 100,000. Nothing new. We know when you look at the whole state, which includes many areas that are rural and less populated, farm areas, areas in the north, you put those together with the whole state. And Long Beach, of course, being in the light blue in California, and you look at California and the county, our death rate per 100 is slightly higher compared to the state, as we know, since this pandemic has started. I also want to share that in our dashboard, we've added some new tabs with some of our state indicators that are listed below, including hospitalizations, positivity rate, case rate, ICU beds, and ventilator use. So that's all available data that we have in front of us. I want to turn, we've been asked a lot at the city about stability criteria. So you're looking at a new slide that's coming up right now. As you can see on this stability criteria, a lot of folks always ask, how are we measuring with the criteria the state gives us? So of the 6 indicators the state has listed, we essentially meet all the criteria but 2. We've met our indicators for ICU beds, ventilators, hospitalizations, and tests. And as you can see there, you look at some of those numbers. You look at the tested population on that criteria, and they're looking at the average test per 100,000. They want us to test more than 150. You look at where Long Beach is at 204, 319. We meet that criteria. You look at hospitalizations, we also meet that criteria. We don't obviously meet the testing positivity rate. We've talked about that. We are at 9%. The state is at 6.4. They want us to be below 8%. So we continue to decrease, and we're working to getting lower. We also don't meet the case rate criteria. As you can see, they want less than 100 total cases per 100,000. Again, we're at 231. The state is at 284. But then when you look at ICU beds or ventilators that are currently in use, we do meet those other criteria. This next image is our ICU bed occupancy rate. And you can see that our ICU bed occupancy rate over time. So the percentage has actually increased slowly over the last few weeks, but we've had consistently a higher percentage of ICU beds available in Long Beach compared to the state. And so that's something that we are also monitoring. Our hospitals right now, and talking to them, they're obviously, everyone's very cautious. They want us to continue to stay safe as we move forward. And ICU is an important comparison for us to maintain. I want to turn a little bit to broadening our testing capacity. We know that testing is a critical piece of preventing the spread of COVID-19. We just opened a brand new testing site with our harbor department here at the city. So the port, along with us, has opened a new site that is drive-up testing for COVID-19 available to dock workers, our hardworking members of the ILWU, truck drivers, their families, other frontline workers at the Port of Long Beach. The port, as you know, we have the second largest container terminal port in the United States. It's a gateway for trade, for getting goods out across the world, for goods coming into our country. It's vital to not just the Long Beach economy, but to the economy of the country and the world. And so we wanted to ensure that we were able to conduct tests there and ensure that we keep all of our workers at the port safe. With the addition of this new site, Long Beach now can do 1,600 COVID-19 tests per day. It's the most and largest testing capacity that we have done since we've started. We've expanded now this testing capacity. As for a city of our size, we have one of the best testing systems now in place. Tests are available every day, and we far exceeded the state's ask of us from a testing perspective. These tests for our personnel in the harbor, of course, are available weekdays from 10 to 1 at the new site at 2100 West Anaheim. And we continue, of course, to have testing at all of our other sites. If you want information about how to test, folks can go to longbeach.gov/COVID-19, and all of our testing information is there. And like always, we welcome our Signal Hill neighbors and neighboring cities. We want to make sure that communities that are not served well or may not have a testing site are still welcome in Long Beach, because we know that everyone staying safe helps all of us. And please, if you have symptoms around COVID-19, please get tested. In closing, I want just to remind folks to continue to stay safe this week. We want to make sure that people are covering their face with masks when they're in public, they're washing their hands, and we're sanitizing surfaces. Want to share that we will have coming up later this week, on Thursday and next week, we're going to start also discussing how we're going to ensure that we keep folks safe around voting. We know that there is a lot of conversation right now in the media around keeping voters safe and voting by mail. As we close, I want to encourage folks, voting by mail is safe. Voting by mail in California works. Ballots will arrive at voting places. We know that we are used to voting by mail, and regardless of some of the rhetoric that is out there, we want to encourage folks this upcoming election to cast ballots and to vote by mail, because everyone will be receiving a ballot. In addition to that, our city clerk is working with the LA County Registrar to place voting ballot drop-off spots. We're going to be putting 12 or 13 of these all across the city at libraries and public facilities. So if you don't want to vote, if you want to put it in the mail, you want to drop it off in a secure strong box, a lock box, you'll be able to do that as well. And we're working on very safe voting centers for those folks that want to vote at the election. But we want to encourage folks this year especially to vote by mail. Everyone will have a ballot. Please do so. And with that, I want to turn this over to Dr. Davis, who of course is leading our response at the Health Department.
Thank you, Mayor. So first, good afternoon. So first, I'd like to talk about Covered California special enrollment. Improving access to health care has always been a critical component of public health, and the crisis conditions of a pandemic make addressing this gap even more urgent. Lack of health insurance presents another barrier for people to access timely, high-quality health care during this pandemic. Those without access to health insurance often seek care for non-emergent conditions from emergency departments, which during a pandemic can become quickly overwhelmed. Extended emergency room wait times and crowded waiting rooms increases risks of exposure and infection among patients and staff alike. For this reason, it's in everyone's best interest to improve access to affordable health care. For those negatively impacted by COVID-19, who may find themselves without health coverage during this time, help is available. Depending on your income and your family size, you may be eligible for either no-cost Medi-Cal or Covered California with financial assistance. To see if you're eligible, call 562-570-7979 between 8 a.m. to 5 p.m. Monday through Friday, to speak to one of our navigators. We have English, Spanish, and Khmer speakers ready to help. If you prefer to have a callback, you can email us at coveredlb, all one word, at longbeach.gov. So coveredlb@longbeach.gov, and we'll call you at your earliest convenience. Remember that Medi-Cal enrollment is all year long, and Covered California COVID-19 special enrollment is scheduled to close by the end of August 2020. So now to turn to testing. Another way we're addressing the disparity in access to affordable health coverage is by offering free COVID-19 testing at multiple sites throughout the city, as we've shared today. As the mayor mentioned, as of Friday, a 5th testing location was established at the Port of Long Beach. The site is now open on weekdays from 10 a.m. to 1 p.m. and 4 p.m. to 7 p.m. Appointments are required and can be made online at our website or by calling 562-570-INFO 4636. On-site registration will be made available for port contractors, including truckers, longshoremen, and other port-related personnel. Mobile testing also continues to be available for individuals who are not able to leave their residence. To request mobile testing, individuals may call 562-570-INFO, which is 4636, or complete the form available on our testing webpage. Of course, those who have access to health insurance should first seek testing through their primary care provider or by consulting their health insurance company. So next I'm going to talk a little bit about donating plasma. If you've tested positive for and fully recovered from COVID-19, you may be able to help other people currently fighting infection by donating your plasma. Those who have been infected by and recovered from COVID-19 may have special antibodies in their plasma that helped their immune systems to fight the virus when they were sick. These antibodies may be able to help others in the same way. While researchers are still determining the effectiveness and relative safety of treating COVID-19 with donated plasma, it seems to have had some success to date. Donating plasma is similar to donating whole blood, where the only sensation you may experience is a small prick. The whole process takes approximately 45 minutes. The criteria to donate are relatively few. So 1, you must have had a laboratory-confirmed diagnosis of COVID-19. 2, you must be completely recovered with no symptoms for at least 14 days prior to donation. And 3, you must meet the criteria for donating blood, which broadly requires that you be in good health, though there are a few travel restrictions as well. Find out if you're eligible and how to donate by visiting www.coronavirus.gov. If you're eligible, I strongly urge you to consider donating plasma, which can help save lives. So I will close with some other resources. If you aren't eligible to donate plasma but are still looking for ways to help, visit longbeach.gov/COVID-19 and click on Help and Donate. You can provide financial assistance, donate goods, offer discounts, or even volunteer. If you meet blood donation criteria but have not been infected with COVID-19, you can donate blood. Another way to help out includes safely offering support to our neighbors using neighbor-to-neighbor cards, which can be accessed on the Help and Donate page. These cards can help open lines of communication between you and your neighbors and may help you find ways you can help each other out. One of the most important things you can do right now is to offer kindness, support, and respect to each other. We're all in this together. Thank you.
Thank you, Dr. Davis. We now have some questions for you from the media. First question comes from Valerie at the Long Beach Post. Go ahead, Valerie.
Hey there. Earlier today, LA County revealed that they meet 5 of the 6 indicators. And I'm just curious, what happens if LA County meets the indicators and we don't? Is there anything that holds us back from reopening with them, or how does that work?
Well, we'd be in a lot of communication with them as far as, and with the state, as far as how we would be allowed to reopen, provided that LA County, if they should meet all of the indicators before we do. So it probably would be a joint discussion and decision that would be made at that time.
Thank you, Dr. Davis. Next question comes from Haley at the Press Telegram. Go ahead, Haley.
Hi. So in terms of the state indicators that Long Beach doesn't meet, I feel like there's been more focus on the positive testing rate than the case rate per 100,000. So I was just wondering if you could speak a little bit more about that indicator and explain what it might take to lower that number from where it is now.
So to talk about the case rate indicator, so basically what that is the number of cases per 100,000 population. So broadly speaking, it's telling you how prevalent COVID-19 infection is in your community. And the state would like the numbers to be less than 100. Being more than 100 puts you on the monitoring list. And so really the way to get that down is to decrease transmission in the community. So all of the safer at home order precautions, the protocols that are put into place for individual sectors, all these things are what's going to drive that number down. So everything that everybody does, whether it's a business sector that's making sure that its employees are wearing a mask and making sure that they're physically distanced and making sure they have plexiglass, not doing things indoors, moving things to outdoors, individuals who are wearing their masks and not gathering, washing their hands, not having gatherings in general, all of those things, the safer at home orders, all the communications. The state has a lot of educational campaigns that are happening right now. So all of those things are what's going to drive that case rate down and allow more things to open and get us off the list.
Thank you. We now have a question from Fox 11 News. Go ahead. Is anyone on from Fox 11 News? Okay, that'll end our questions.
Thank you.
We will now move on to Spanish translation.
Muy buenas tardes. Hoy es nuestro comunicado de prensa para hoy, lunes 17 de agosto del 2020. Vamos a empezar con datos generales. A la fecha, 9,736 residentes han dado positivo por COVID-19. Nuestra tasa de positividad es del 9%, ligeramente superior a la semana pasada, pero recordemos que el Estado requiere que estemos menos del 8% para poder llegar o quitarse de la lista de monitoreo. Además, aproximadamente 8,481 personas se han recuperado y desafortunadamente hemos perdido un total de 190 residentes de Long Beach por COVID-19. De esos 190 residentes, 127 de esas muertes han sido asociados con centros de atención a largo plazo. Vamos a hablar un poco sobre los datos estatales. La semana pasada tuvimos una actualización de nuestros números a nivel local con COVID-19, compartiendo los datos más recientes disponibles sobre casos, hospitalizaciones, muertes y pruebas. Quiero recordarles que tenemos esta información en el panel de datos de la ciudad que está disponible en nuestro sitio de web de COVID-19, localizado en la página longbeach.gov/COVID-19. Hoy quiero hablar un poco sobre unos datos locales y también del estado. Entonces vamos a comparar los datos locales aquí en la ciudad de Long Beach con el estado de California. Hasta el 16 de agosto se han reportado un total de 621,562 casos de COVID-19 en el estado de California y hemos tenido 11,224 muertes en todo el estado. Actualmente tenemos a 527 residentes de California con COVID-19 que están hospitalizados. Vamos a hablar un poco sobre las imágenes que fueron mostradas. La primera imagen mostró la cantidad de casos de COVID-19 por cada 100,000 habitantes. Long Beach estaba representada por la línea azul clara con una tasa de casos de 2,083 por 100,000. Es más alta que la tasa que tenemos del estado que es 1,573 por 100,000. La línea amarilla que se mostró es el condado de Los Ángeles y la línea gris es la ciudad de Los Ángeles. También hemos compartido la segunda imagen que se mostró, que es nuestra cantidad de muertes por cada 100,000 personas. Nuevamente, Long Beach fue mostrada en la línea azul clara y California en la línea azul oscura. Nuestra tasa de casos por 100,000 es un poco más alta que en comparación con el estado. Recuerden que estamos comparando los datos que tenemos aquí localmente con el estado y aunque estamos mejor que el condado de Los Ángeles, estamos más altos que en comparación con el estado. Queremos también mencionar que se agregó una nueva parte al panel con nuestros indicadores de estado que estamos hablando ahorita. Puede visitar la página de web que acabo de mostrar. El promedio de pruebas por día por 100,000 habitantes es la primera indicadora que están viendo para la lista de monitoreo estatal. El segundo es hospitalizaciones estables. La tercera, tasa de positividad. Esto es el porcentaje medio de pruebas positivas. El cuarto es número de casos. Quinto, porcentajes de camillas en unidades de cuidados intensivos disponibles actualmente. Y la última es ventiladores actualmente disponibles. He mencionado anteriormente y todavía estamos que llegamos a 4 de las 6 indicadores para removernos de la lista de monitoreo estatal. Entonces, faltan 2 indicadores a las cuales no estamos llegando, que es el número de casos y tasa de positividad. La tercera imagen fue la criteria de estabilidad y voy a hablar un poco comparando a Long Beach con el estado. Acuérdense que tenemos esos 6 cosas que tenemos que llegar. El estado requiere que tengamos menos de 150 exámenes positivos por 100,000 y ahorita estamos a 204. Son 204 exámenes que estamos ofreciendo por cada 100,000 y el estado ofrece 319. Entonces, tenemos que tener por lo menos 150 exámenes por día por cada 100,000 de personas y tenemos 204. La segunda, las hospitalizaciones, no ha cambiado, sigue igual. En el estado ha bajado las hospitalizaciones por un 6.3%. También, como mencioné anteriormente, la positividad de casos, estamos a 9% y en el estado está a 6.4%. Los casos, entonces, lo que requiere el estado para poder quitarnos de la lista de monitoreo es 100 casos por cada 100,000 personas y ahorita estamos a 231 casos por cada 100,000. En el estado está a 284. Vamos ahora a hablar sobre la cuarta imagen que se mostró, que muestra los cambios en las tasas de ocupación de camillas de la unidad de cuidado intensivo a lo largo del tiempo. Este porcentaje ha aumentado lentamente durante las últimas semanas. Sin embargo, siempre hemos tenido un mayor porcentaje de camillas disponibles en el área de Long Beach en comparación con el estado. Vamos a hablar sobre un nuevo sitio para pruebas de COVID-19. Esto es para trabajadores del puerto. Sabemos que las pruebas son fundamentales para prevenir la propagación de COVID-19 y hay un nuevo sitio en el distrito del puerto que ahora está disponible para los trabajadores del puerto y también el público. El puerto de Long Beach es el segundo ocupado de los Estados Unidos y es muy importante porque no solo surte a nuestra región, sino también a todos los Estados Unidos. A partir de hoy, las pruebas de conducción para COVID-19 están disponibles para trabajadores, portuarios, camioneros y otros socios laborales del puerto. Esto va a ser en vehículo, el examen se va a hacer en su vehículo. Con la adición de este sitio, la ciudad tendrá un total de 1,600 pruebas disponibles diarias para COVID-19. Las pruebas gratuitas estarán disponibles para el personal del puerto y también el público de lunes a viernes de 10 de la mañana a 1 de la tarde. La dirección es 2100 West Anaheim Street, de 10 a 1 de lunes a viernes. También queremos recordarle que hay varios otros sitios que todavía están ofreciendo exámenes de COVID-19. Vamos a hablar un poco sobre ellos. El primero es el Vet Stadium, el Estadio Veteranos, de lunes a viernes de 10 a 1 y de 3 a 5 de la tarde. También el Colegio de Long Beach, que está localizado por la Orange y Pacific Coast Highway, está ofreciendo exámenes de lunes a viernes entre las 10 de la mañana a 1 de la tarde. Para aquellos que quieran tomar el examen en un fin de semana, los exámenes están disponibles los sábados y domingos en Cabrillo High School entre las 10 y 1 de la tarde, 10 de la mañana a 1 de la tarde y otra vez de 3 a 5 de la tarde. Quiero recordarles que sí se requieren citas, pero hay muchas citas generalmente disponibles el mismo día o al día siguiente. Puede hacer la cita por nuestro sitio web en longbeach.gov/ubicua COVID-19 o llamando a nuestra línea de información en área 562-570-4636. Como siempre, los residentes de Long Beach, Signal Hill, Lakewood, Compton y Paramount son bienvenidos. Si siente que tiene síntomas de COVID-19, también puede hacerse una prueba sin cita en nuestro centro de evaluación rápida localizado en el Colegio de Long Beach, como mencioné anteriormente, localizado por la Orange y Pacific Coast Highway. Ese centro de evaluación rápida está disponible de lunes a viernes de 10 a 1 de la tarde. Entonces, para aquellos ustedes que quizás despertaron con síntomas y se quieren hacer el examen y no tienen una cita o no pudieron agarrar cita, pueden ir a esa localidad. También otra cosa que quiero mencionar son las pruebas móviles. Las pruebas móviles para aquellas personas que quizás no pueden ir a un sitio, pueden llamar al mismo número 562-570-4636. Quiero mencionar algo que el alcalde mencionó para la elección que va a venir en noviembre. Pueden votar por correo. La ciudad de Long Beach está trabajando muy cercanamente con el estado para poder ofrecer de 12 a 13 cajas que van a estar distribuidas por toda la ciudad para que ustedes vayan a poder dejar su voto o pueden también mandarlo por correo. Eso sería en librerías y edificios públicos. Pero también quiere que todos ustedes sepan que sí va a haber centros seguros para aquellos que quieran votar en persona. Ok, ahora vamos a hablar sobre la inscripción especial de Cover California. El mejorar el acceso a la atención médica siempre ha sido un componente crítico para la salud pública. Las condiciones de crisis de una pandemia hacen que abordar esta brecha sea aún más urgente. La falta de seguro médico presenta otra barrera para que las personas tengan acceso a atención médica oportuna y de alta calidad durante esta pandemia. Aquellos que no tienen acceso a un seguro médico a menudo que buscan atención para condiciones no urgentes, van a los departamentos de emergencia que durante una pandemia pueden verse llenos rápidamente. Los tiempos de espera prolongados en la sala de emergencia y las salas de espera llenas aumentan el riesgo de exposición e infección entre los pacientes y el personal por igual. Por esta razón, lo mejor para todos es mejorar el acceso a una atención médica. Como lo que quieren decir es que para aquellas personas que no tienen aseguranza y quizás no pueden ir normalmente con un doctor, una clínica, van a estos sitios, departamentos de emergencia en los hospitales, y queremos prevenir que esas personas se vayan a poner en riesgo de infectarse con COVID-19. Según sus ingresos y el tamaño de su familia, puede ser elegible para Medi-Cal sin costo o Covered California con ayuda financiera. Para ver si usted es elegible para una de estas cosas, por favor llame al área 562-570-7979 de 8 a 5 de la tarde, de lunes a viernes, para hablar con uno de nuestros representantes que pueden asistirle en español. Si prefiere que le regresen la llamada, puede mandar un correo electrónico a coveredlb@longbeach.gov. Eso es coveredlb @longbeach.gov y le regresarán su llamada. Recuerde que la inscripción a Medi-Cal es durante todo el año, y la inscripción para Covered California para COVID-19 está programada para cerrar a fines de este mes. Así es que, por favor, comuníquese si ocupa de esa asistencia. Le repito, el número para eso es área 562-570-7979 de 8 de la mañana a 5 de la tarde, de lunes a viernes. Donación de plasma. Si ha dado positivo y ya se ha recuperado completamente de COVID-19, es posible que pueda ayudar a otras personas que actualmente luchan contra la infección donando su plasma. Aquellos que se han infectado y se han recuperado de COVID-19 pueden tener anticuerpos especiales en su plasma que ayudarán a su sistema inmunológico a combatir el virus cuando estaban enfermos. Estos anticuerpos pueden ayudar a otros de la misma manera. Los investigadores aún están determinando la efectividad y la seguridad relativa del tratamiento de COVID-19 con plasma donado. Parece haber tenido mucho éxito hasta la fecha. Donar plasma es similar a donar sangre, y donde la única sensación que puede experimentar es un pequeño pinchazo. Todo el proceso es en menos de 45 minutos. Los criterios para donar son relativamente pocos. Debe haber tenido un diagnóstico formal confirmado por laboratorio de COVID-19. Debe estar completamente recuperado sin síntomas por al menos 14 días antes de la donación, y debe cumplir con los criterios para la donación de sangre que generalmente requieren de buena salud, aunque también existen algunas restricciones de viaje. Por favor, visite coronavirus.gov para más información y puede ayudarnos a salvar vidas. Vamos a hablar ahora sobre otros recursos. Si no tiene los requisitos para donar plasma, pero aún busca más información para ayudar, por favor visite longbeach.gov/COVID-19 y haga clic en ayudar y donar. Puede brindar asistencia financiera, donar bienes, ofrecer descuentos o también ser voluntario. Si cumple con los criterios de donación de sangre, pero se ha infectado con COVID-19, también puede donar sangre. Vamos a hablar un poco sobre los centros para el calor. Por último, con las temperaturas más altas que continúan ahorita, Queremos informarles que hay centros de enfriamiento abiertos hasta este miércoles 19 de agosto. Los centros de enfriamiento son espacios donde los residentes pueden sentarse en una instalación con aire acondicionado para escapar el calor. Seguimos los protocolos de seguridad de COVID-19 en todas las ubicaciones de los centros de enfriamiento, que incluyen exámenes de salud, controles de temperatura, distanciamiento físico y el requisito de cubrirse la cara. Los centros de enfriamiento estarán abiertos desde hoy hasta el miércoles, desde el mediodía, 12 del mediodía, hasta las 6 de la tarde. Estas son las localidades que van a estar abiertas: Parque Admiral Kidd, Parque Houghton, Centro para Personas Mayores de Long Beach, Parque McBride, el Parque El Dorado West. Y también recuerde tomar medidas para reducir el riesgo de enfermedades relacionadas con el calor, mantenerse hidratado, cuidar a sus seres queridos, especialmente aquellas personas mayores, asegurarse de que sus mascotas tengan bastante agua y sombra. Nunca deje bebé, niños o mascotas dentro de un vehículo estacionado y reduzca su tiempo al sol durante las horas del mediodía. Más consejos para evitar enfermedades y lesiones por calor están disponibles en el sitio del Departamento de Salud, localizado en longbeach.gov/health o salud, HEALTH. Gracias por acompañarnos. Esto es todo por hoy.